We are the University of Washington Center for Anti-Racism and Community Health, and we're known as the Arch Center. And our mission really is to elevate, uplift, and amplify voices from individuals and communities who've been systematically marginalized in public health and healthcare, and really to be able to be in a position as an institution to champion community-driven actions for health equity.
Discrimination is a health crisis in the United States, and it always has been, and to have discussions around ways to solve these health crises is important. And the Arch Center is instrumental in doing that, in bringing those discussions into an academic setting and supporting communities of color to solve these issues.
The Arch Center is unique in that of the centers that have been developed around the country specific to anti-racism that are housed in schools of public health, some are looking at metrics. Some are really looking at curricula and workforce development. The way I see Arch is looking at multiple domains, but one specific piece is embedded in the actual name, which is community health, right? This centering of community engagement, meaning that people with lived experience and individuals who are direct recipients of the findings of programs in public health are actually engaged in creating the center.
We have already been tapped by public health entities, agencies, to be able to perform anti-racist evaluations of their programs and their processes for engaging with communities. So I think that's really exciting, because one of our main goals in that work is voice, centering the communities who are most impacted by structural racism to ensure that they are involved in the decision-making around the public health strategies that are being brought to the table.
Very early in the pandemic, King County and Public Health took the lead in creating a Pandemic and Racism Community Advisory Group. Soon, when we had the declaration of racism as a public health crisis, also community asked us to put our anti-racism work collectively at the center of that work, and for the whole effort to be community-led and driven. So we have had this table that now the Arch Center is a key participant at. The partners there are predominantly from Black and Indigenous organizations. And it's really a space where we can bring issues, potential policies, and really trying to push us in terms of how do we center community in our decision making, how do we have them drive the agenda and drive our actions.
This work is so vitally important to community. Historically speaking, the community hasn't been at the table to identify its own priorities, to identify our community-led solutions. And so what I found to be very helpful is to be in these spaces, to really speak to some of those priorities and then to do the follow-through, to just make certain that those recommendations are being implemented and track those outcomes, and also make sure that we're documenting the lessons learned.
There's multiple ways that they are supporting research around indigeneity, issues around Indigenous health. One example is bringing a film in called Imagining the Indian on Indigenous Peoples Day.
I think another part of the Arch Center that's so unique is its commitment to Black scholarship around different theories in public health. So things like critical race theory, public health critical race praxis, intersectionality theory. And I've really been able to pull on that theory and the different faculty who've taught me about it into my own research.
What I'm most excited about happening or beginning to happen here at the Arch Center is building critical mass of bringing people together who are passionate about equity, who are wanting to make a difference in the health and well-being of communities. Building those relationships and forming those connections and actually finding joy in the work, as well as being able to support each other in the challenges. That's what's been most exciting, and that I'm looking forward to continuing to grow.